Iliotibial band syndrome of the knee, or IT band syndrome, is a very common knee complaint, especially among runners. In this video, I'll explain what it is, what the common signs and symptoms are, and some common and innovative treatments to recover from it. I'm Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. IT band syndrome is very, very common. It's not shown on this model. This is sort of the inside of the knee, this side of the outside of the knee, but it would be a thick band of tissue running along the outside of the knee. Typically, people with IT band issues have pain right here at what's called the lateral femoral epicondyle, a bony prominence on the outside of the knee. What happens is, with repetitive motion in runners, repetitive flexion and extension, you develop irritation between that bony prominence and that tissue, the IT band. And most of the time you can take some rest or maybe short period of ice or something like that and it gets better. But for people that, especially high level runners, sometimes cyclists, but it can be, those are the most common, but it can be lots of different people where they're constantly doing those motions. It can become a really difficult source of pain. Now, fortunately, it is not something that typically needs surgery. Physical therapy, I'm a big believer, can be helpful. I talk a lot about on this channel. I'm not a huge cortisone fan, but sometimes one time injected right into that area where the IT band rubs along the lateral femoral epicondyle just to see if that relieves the pain. If it gets rid of it completely and it doesn't come back, great. That's all that it takes as well. As far as some of the newer treatments that potentially can be used, I've seen shockwave therapy used effectively for that. In either physician's office that have a shockwave or physical therapist's office that have shockwave. I've heard of some other physical therapy modalities that can be helpful. Not so much ultrasound or e-stim, but some of the Graston techniques people have told me have been fairly helpful. And then other types of injections. It's been described things like PRP potentially could be helpful. I've heard people using exosomes. I've heard of people using peptides. I don't really know that there's studies that necessarily support that. That would be something you'd have to talk to your doctor about and see if that's potentially right for you. But again, it almost always gets better without any kind of surgery. In my now 18-year career, I've only seen surgery for that one time. It was when I was in my sports medicine fellowship that one of the attendings did it on a patient that had tried everything known to man. So what they did is basically the small area of the IT band that had become diseased, the surgeon just sort of cut that small area of tissue out and then closed the layer of the IT band together. And it did work, but again, it usually does not get to that point. Now, I'd love to hear your experience with your knee injury, whether it's IT band syndrome or something else. Leave those in the comments below. Just understand I can't give you medical advice, but I'll try to answer your question in a future video. Make sure to subscribe to this channel, click the bell to be notified when I release a new video and when I start a new live stream like my Ask Dr. Geier live shows. If you have knee pain or hip or shoulder or any other joint pain and you want to get significantly better in the next 30 days without cortisone shots or surgery, learn more about working with me in the description below this video. Thanks for watching. I look forward to helping you feel, look, and perform better than ever.